from all of my equipment. Hi, my name is Ellie. I'm gonna be your student nurse today. Can you tell me your name and date of birth? Great, I'm gonna double check that. Okay. So today the doctor ordered me to come and assess and give you a clean dressing on your wound. So we're gonna be doing that. I'm gonna do, make sure I provide privacy before we start, safety assessment, beds in the locked position, no slip socks are on, call lights in reach, beds locked. I'm gonna make sure you're in a comfortable position for this dressing change. Can you tell me your pain? Okay, patient will tell me their pain. If doctor ordered medication, I would assess that with the pain given by the patient. And yeah, do you have any questions about the procedure or just changing your dressing? No? Okay, great. Okay, so start with hand hygiene. I'm just gonna remove your cover, but I won't remove anything more than what's needed to see your abdominal site. Okay, and then I'm gonna remove the old covering with the push-pull method on the tape and the skin, just to make sure that I don't rip any skin or cause any discomfort. Center. Look if there's any drainage or odor, particularly on the abdomen pad. Okay, I'm gonna remove the other dressing. Okay, look at that. So there is no purulent drainage, there's no odor. There is some redness and signs of granulation, which is totally normal, shows signs of actually healing. The edges are pretty smooth and not rigid, so they'll help with healing process. And then on the peri-wound area, there is light redness and inflammation, but that's normal and actually shows signs of healing. So now I'm going to change my gloves because they're dirty. I'm going to measure the wound and also check for tunneling. Any tunneling and yes. Okay. So I'm going to measure the outside of the wound. Lengthwise first, it is about 13.5 centimeters long, about 3 centimeters in width. And then I'm going to check for tunneling. I don't see any. If there was tunneling or any purulent drainage, I could use this to get a sample and send that to the lab. So again, no signs of tunneling, so I'm just going to measure in the deepest part of the wound. Put my finger down. And I'm about 2.5 centimeters deep. I'm going to change my Gloves again, just because I was touching the dirty wound. I'm just gonna grab new gloves because I didn't hand sanitize. Okay, next. I have my gauze here, and I'm going to make sure that it is seeped in, saturated. Okay. Now I'm going to take it from the outer corners and make little pockets. Okay. Now I'm going to swipe from top to bottom once down the middle of the wound. I'm going to do a new piece of gauze every single time I swipe down. Okay. Now I'm going to do the further outside, swipe down, gauze. I'm going to do the other side of the lip. Okay. And now I'm going to clean the peri-wound area, just in case there was anything left over on the outside. So I'm going to swipe once on the outside. And once on the other side. Okay. I'm going to get rid of my gloves just because I was touching inside the wound. I'm going to hand sanitize and grab a pair of new gloves. I'm going to take some clean gauze that's in the packaging, and I'm going to be stuffing the wound to help with healing. Okay, so I'm going to do all the way to the edges, fold and tuck it in, and then I want to make sure I cover all parts of the wound, so I'm going to take another piece and just make sure I get all the way to the top. And then I might need more gauze to put in the wound if there was a lot of drainage. So now I'm going to take my abdomen pad, the blue line will go towards the sky, like that. And now I'm going to take my tape. I'm going to be doing a window pane tape structure, just so it's very secure and comfortable for the patient. If the patient does have hair in the pubic area, I would shave and try to prevent tape from going on there, just to help with discomfort. Make sure all my edges are flat. I'm going to remove my gloves. I'm going to take another piece of tape and just initial and kind of document for the next nurse my name and time and date that this wound change was done at. So okay, I'm gonna place this onto the tape. Okay, so I'm gonna cover my patient back up. I'm going to ask, okay, can you give me your pain again? If the pain was too high, I would see if the doctor ordered medication, and then if they did, I would do my 11 rights, and then also my 3 checks before administering any medication. Okay, do you have any questions? Do you have any signs of discomfort? Okay, great, and thank you. I'll let the next nurse know that you have had a wound change.